Hello, everyone. I'm Dr. Caroline Roberts. I am, as stated, an endocrinologist, and I serve as medical director of research at Virta. And I have the honor of taking care of Virta members every day. I'm really excited to be closing out day one of Moonshots with a topic that's incredibly important and that is gaining mainstream traction. I know you'll all be riveted. With me for this discussion are two esteemed guests. We have Dr. Georgia Eid, an internationally recognized expert in nutrition and metabolic psychiatry, and the author of Change Your Diet, Change Your Mind, which I recommend. And Dr. Chris Palmer, a Harvard psychiatrist and researcher working at the interface of metabolism and mental health, and the author of Brain Energy, which I also recommend. So, welcome to my guests. Let's level set before we dive in. Metabolic psychiatry is a relatively new term, and everyone joining us today might not be familiar with it and with your specific area of expertise. So, can you define this psychiatric subspecialty? Let's start with you, Dr. Palmer.
Um, it's a really important question, and although it in some ways is newly being talked about, in fact, we have over a century of evidence for this. And if you go back in time, looking at some of the most highly regarded neuroscientists and psychiatrists and neurologists over the past centuries, way back in the day, they were actually hyper focused on the role of brain metabolism in mental disorders, including very severe mental disorders like chronic depression, bipolar disorder, and schizophrenia. And so, in some ways, this is a renaissance of information that somehow lost its way, and we're finding our way back. But the overarching concept is that metabolism, writ large, in the way that it affects almost every organ and tissue in the body, also impacts the human brain. And when it does, it can sometimes result in symptoms that we end up labeling mental illness, whether that is anxiety, chronic depression, bipolar, schizophrenia, and other disorders. And by diving into this science of metabolism and how it influences the brain, we can actually develop novel treatment strategies such as dietary interventions.
That's very powerful, and I can entirely relate to looking back to the much older generations and their focus on nutrition for the care of diabetes, which we are seeing in droves right now. What role does metabolic psychiatry play in transforming the treatment of mental health conditions, and how may this shift redefine traditional healthcare approaches for employers and members? Dr. Eid, I'd love to hear your thoughts.
Yes, this is metabolic psychiatry and nutritional psychiatry, which is also relatively thought of as a newly discovered field, which also those principles go back, millennia. The way we eat matters to every cell in the body, including cells of the brain. And the brain is part of the body, and it's important to remember that. So the role that this can play is really where the psychiatry has been stuck in the same paradigm for about 75 years. We've really been thinking about mental health conditions as chemical imbalances, kind of mysterious chemical imbalances in the brain that should be addressed or are best addressed with medications. And not only do we have any tests, I can't tell you what kind of chemical imbalances you have in your brain in my office, or genetic tests to tell you why you might be depressed or anxious or have ADHD or whatever it might be. But the way that we practice psychiatry for so long has really been trial and error medication management. And we've really been practicing in the dark without really any guideposts to offer people. It's very frustrating and demoralizing for people. So this is a quantum leap. It's a really exciting time, not only to be a psychiatrist, but also a really hopeful time and an empowering time to be a person with a mental health condition, which is now most of us. And so this is great because we now have when we focus on metabolic health, which, as Dr. Palmer was saying, this is every cell in the body needs to be functioning at its metabolic best. It's really the operating system of our cells. And if our cells aren't functioning properly, things can go wrong, and often quite spectacularly, including in the brain. So these are really empowering and powerful interventions, because we're looking not just at the chemical imbalances, which in some cases do play a role, but we're looking at the deeper metabolic drivers of those chemical imbalances. And that allows us to design interventions, especially the ketogenic diet, which is a really powerful metabolic intervention, to heal, not just cover up the symptoms, but to heal the underlying problems and allow people to get on with their lives and achieve their personal best. So it's a revolution, a paradigm shift.
It's music to my ears. I would love to hear from either of you, actually, about the impact of nutrition on the brain and brain health. How about we'll start with you, Dr. Palmer, and then we'll ask Dr. Eid to add.
Sure. Although a lot of people think about nutrition and brain health in somewhat simplistic terms, like eat a healthy diet, whatever that happens to be. And if you're eating a healthy diet and you have brain symptoms, then clearly diet doesn't play any role in your brain symptoms. And unfortunately, that's really where the overwhelming majority of professionals and society is right now. Is if you're eating a Mediterranean diet and that's a healthy diet, then clearly it's not playing a role. But in fact, it gets complicated quickly. I mean, there are numerous different mechanisms of action through which diet and dietary interventions and the composition of diet can impact brain health. So some quick ones are nutrients. Like there are nutrient deficiencies, vitamin B12 deficiency, iron, folate, others, that clearly we are getting those from our diet. And if we aren't, we might be suffering from neuropsychiatric disorders. And so identifying those nutrient deficiencies and correcting them is one strategy. Other people can have sensitivities to food, such as gluten, and that can cause neuropsychiatric symptoms with the gut inflammation. While we're at the gut microbiome plays a huge role in overall metabolism and metabolic health, but also brain health and brain function. And so what we eat, it's, the bacteria in our guts get first dibs. They end up turning that into neurotransmitters, hormones, neuropeptides, and other things that actually influence brain health. And then I'll end with dietary interventions. And so when I think about the ketogenic diet in particular, I actually think of it as an intervention. And the clearest example of how and why it can be an intervention is that you can have infants who have uncontrollable treatment-resistant epilepsy due to a genetic problem. So the root cause of their brain disorder is a genetic variation or a genetic mutation. And yet, a dietary intervention like the ketogenic diet can sometimes stop their seizures. So those children did not necessarily have a bad diet. They weren't on a bad diet and that we're correcting. They actually had a severe brain condition, likely due to disrupted metabolism in their brain. And by using a dietary intervention and changing metabolism and offering ketones as a fuel source, you can actually correct the abnormality. But I'll stop there and give Dr. Eid a chance to chime in with anything else if she wants.
Yeah, so the impact of nutrition on brain health is enormous. It really is. There are many aspects to metabolic health, levers you can pull. People, I think, are well aware of these. These are not just nutrition, but sleep and exercise and stress management and reducing toxic exposures and things like the circadian rhythm, natural light. But those areas of metabolic health really aren't controversial. We all know we need to sleep and manage our stress and not expose ourselves to toxins and so forth. But the reason the impact of nutrition on mental health is, as Dr. Palmer was saying, it's underappreciated because we don't have most of us have been we've been fed the wrong information about what a healthy diet is supposed to look like, what our cells actually need to function at their best. And so we've got a global dietary and nutrition crisis, lots of people eating the wrong way. Therefore, we have a global metabolic crisis, lots of people with metabolic disorders of many different kinds, diabetes, obesity, we could go on. And therefore, we also have a global mental health crisis. They're all connected. And nutrition isn't the only factor, but it's the only factor that we're not getting right. There's so much controversy about what we're supposed to eat. And it's because we've been misled by ideologies and mythologies and really unscientific guesswork, wild guesses and wishful thinking about what we're supposed to eat. And therefore, our cells they're not being nourished properly. They're not being protected from damaging ingredients, and they're not being energized properly. And so if we get those fundamental principles right, I believe that most of us, ketogenic diet or not, could experience tremendous benefits, not just in terms of intervening with existing issues, but preventing chronic disease. If we get the truth about brain food right, so to do this right, you have to combine the truth about nutrition, which is little known, with the cutting edge science of brain metabolism. And when you do that, I honestly believe that we would have a much, much healthier world, brain and body, both.
Yes, I couldn't agree more, and I love thinking about it as nutrients for the brain and body, and maybe someday we'll blur those more appropriately and more regularly and routinely. Thinking big picture and talking about a disease that touches most, if not all of us, let's talk about Alzheimer's. Are there implications and opportunities to make headway in this very hard to treat and absolutely devastating disease?
I'll at least start 100%. I mean, I suspect most of the people in this audience already know. But for those of you who don't, Alzheimer's disease, most of the cutting edge research is increasingly demonstrating that it is a metabolic / mitochondrial disorder. And think about those terms, they're not really interchangeable. They do mean different things, but they are highly interrelated. And so we see things like glucose hypometabolism, meaning your cells aren't getting enough energy from glucose. We see things like oxidative stress, mitochondrial dysfunction, neuroinflammation. These are all primary signals for Alzheimer's disease. And right now, most of the treatments that people are pursuing for the disorder are not targeting brain metabolism. And yet there are preliminary studies of the ketogenic diet, but also of other, medications, supplements, vitamins, other lifestyle strategies. If they improve metabolic health, they reduce risk for Alzheimer's disease, and or the early signals are that they might slow progression and or they might play a role. And so, I know the last session was on GLP-1s. And for those of you who don't know, there are phase 3 clinical trials now of GLP-1s for Alzheimer's disease, because GLP-1s are clearly having an impact on brain and body metabolism. And so by no means am I saying there's a one-size-fits-all treatment, but when you see the big picture, the treatments do begin to become obvious.
Yes, so Alzheimer's disease is a wonderful example because it's really, we've got going back at least 20 years, really strong, really strong science, multiple lines of high quality evidence demonstrating not just an association between insulin resistance, high insulin levels, and cognitive dysfunction, but causal relationship between insulin resistance, which really is just a manifestation of insulin levels running too high. So if your insulin levels are running too high too often, what can happen then, so this is why it's called often type 3 diabetes, is that there's something wrong with glucose metabolism in the brain. As Dr. Palmer was saying, the brain can't make enough energy from glucose. It's losing its ability to turn glucose into energy. And if that happens, so by the time you notice any even mild, what's called mild cognitive impairment, which are these subtle earlier signs of memory problems, you can already have lost up to 25% of your brain's glucose processing power. That's a dire predicament. And really your only hope in that situation, you're going to need a supplemental fuel source. Your only hope is ketones. That's your only, that you can't replace all the glucose, but you can help it. You can bridge that energy gap with ketones. And but Alzheimer's disease is a disease that develops over decades. What's happening is over decades, the brain is gradually losing its glucose processing power. And that can begin in your 20s. And we have evidence of that. And, PET scan is looking at glucose metabolism in brain. So this is really, really important. Most people don't know that this is something that they could potentially prevent if they understood. So Alzheimer's disease is a neurodegenerative condition. That just means brain cells are dying. What's killing them? They're not getting enough energy. Now, there are other factors. Of course, it's never just this simple, but this is really the most powerful lever you can pull. If you understand that high insulin levels damage brain metabolism, high glucose and insulin levels damage brain metabolism, then you've got something you can actually do about it and try to turn things around before it's too late.
Wonderfully put. And I believe I saw a paper recently that showed that earlier onset type 2 diabetes correlates with Alzheimer's, which is just to add to the data that's already out there, and really motivating people like us to make a difference as early as possible. Turning things a little bit in a different direction, benefits programs are often viewed in silos, with mental health, cardiometabolic health, and general physical health treated as separate categories. And yet we know that the connection between these aspects of health is critical. So how can organizations begin to integrate a food-first approach into their mental health strategies, and what impact could this have on other health conditions, including those that are including specific mental health conditions like depression and bipolar disorder? And let's start with you, Dr. Eid. Sorry, Dr.
Oh,
Palmer.
sure.
I'll give you the floor first.
Yeah, sure. The same thing happens in insurance companies and in large organizations as happens in healthcare and happens in medical school, is we're chopping the body up into pieces. And this makes absolutely no sense. All cells follow the same rules. All cells need the same basic nutritional care. And it wouldn't make sense to need a different diet or a different treatment for every different organ in the body. It just doesn't make any sense. So I think it's really important. This is something that Dr. Palmer and I and some of our colleagues also, when we shifted the way we practiced, it wasn't because we were taught to do this. And you have to start thinking outside the lines. It's not good enough to stay in your own lane and just practice at focusing on one organ. You must be a whole person psychiatrist. You must be a whole person doctor. You must be a whole person insurance provider, a whole person employer. I mean, this is the only way that's going to make any sense, is for us to understand the fundamentals of how cells work, what they need to be healthy. If you take care of your cells, they will take care of you. It doesn't matter which organ we're talking about. So we've really lost our way. And so these are, in terms of, organizations being able to make a difference, there are so many simple things that they could do. Most people out there who who actually still go to work, physically go to work, you see, what's in the waiting room, what's in the break room, what people, and the parties and social events that are sponsored by corporations. There's all kinds of junk food, all kinds of addictive. There's alcohol, there's sugar, there's starch, there's junk food, vending machines, sodas. We're not promoting a culture of good health. We don't get enough light, we don't get enough sleep, we don't get enough exercise. But the food culture within our organizations could easily be, they're just very simple things that people could do to educate their employees and their members, re-educate them about what a healthy diet's supposed to look like, and set the tone and an example for a healthier workplace. And I think we could even incentivize people for meeting certain metabolic goals and provide support groups, whether online or in person. So many opportunities to really lead the way and improve morale and productivity and health.
I love the comments about changing the environment because, as we know, cigarette smoking and tobacco use has declined dramatically in the US. And a lot of that has to do with changes to the environment by not allowing smoking indoors, not allowing smoking in the workplace, and in many public places. Moving to you, Dr. Palmer, I would love to hear your thoughts on how organizations can integrate strategies for their beneficiaries.
It's actually a really important question, but the real answer is this is going to be a disruptive, challenging issue to tackle. Right now, mental health patients don't have access to dietitians or nutritional information. The organization I'm at, largest healthcare organizations, state of Massachusetts, if you have Medicare and obesity, you can't see a dietitian. We're not allowed to bill the insurance company, and we're not allowed to bill privately, and so you're just out of luck. And that absolutely goes for mental health patients. I'm fighting to get patients access to dietitians and nutritional counseling, and it is almost impossible. And I'm increasingly getting the answer like that's just not possible in our current system. So I don't want to sugarcoat this. This is a real issue. And yet, sugarcoat this. That's a great pun. But I really don't want to sugarcoat this because that'll do more harm. But the reality is, if you look around the world, the rates of metabolic disorders are skyrocketing. The rates of mental health disorders across a broad range of diagnoses are skyrocketing. These are not unrelated. The rates of autism are skyrocketing. And unbeknownst to most people, if parents suffer from obesity and or diabetes, they are much more likely to have children with neurodevelopmental disorders. That includes autism, and that includes ADHD. And everybody's scratching their heads trying to figure out, where's all this autism and ADHD coming from? Are we just overdiagnosing it? And I am here to at least argue, no, I don't think we are overdiagnosing it. I think the rates are really skyrocketing at the same time that the rates of obesity and diabetes are skyrocketing. And so I think it is imperative that we come up with solutions to address this. Exactly how it's going to work. How are we going to get payers to do this? It's not rocket science. I think everybody kind of knows what the answer is. Let's start covering these services. Let's develop effective evidence-based strategies. Let's demonstrate that we can improve outcomes. Let's demonstrate that we can reduce costs. So the work is in front of us. Virta is leading the way in many ways on these fronts, but we have so much more work to do. But I think we need to buckle down and get to it.
Yeah, it's really, business at the private sector. They're expected to be forward-thinking, innovative, early adopters, disruptors, as Dr. Palmer was saying. These sort of archaic institutions which move so slowly, things like the medical establishment and even a lot of academic centers and the governmental guidelines, those institutions change their tune very slowly. But in the private sector, you have that opportunity to try things out and see if they work better. And so this is it's a really great opportunity, right? So you can become a pivotal part of this. I mean, a lot of what drives this work, this research, and the clinical success that we're seeing in case studies and our clinical practices and research studies is being fueled by social media and individual results. People try these interventions and they work. They work quickly in many cases and much more quickly and better than the standard guidelines. And so I think that there's a real opportunity here for workplaces, insurers, et cetera, to run with the science, the clinical trials that have already been conducted and that are being conducted, run with the early evidence and make a real difference. Empower your patients, empower your members to get healthy. And so that we're not creating lifelong patients and having disability, people calling in sick from work and, people not productive and people demoralized and doctors and nurses leaving medicine in droves because everyone's overworked. This is a real opportunity. We actually already know so much about how to eat in a healthy way if we just follow the biology rather than the ideology. Lots of good things will happen, and it's a very low risk, very high potential benefit change to make in an organization.
I am so inspired by your words. One thing that was mentioned earlier is that this is not mainstream and that us three and others have kind of taken a different tack. And I would love to hear briefly from you, because I think we've got some time, about how you got to this point. I can tell you that for me, it was seeing a patient managing his health in ways that I didn't think was possible. And I got an excellent medical education. But what I had learned was not possible. What he was doing was not possible with my typical instructions and recommendations. He was following something that he found on his own. And it was seeing that with my own eyes that changed the course of my career. If you're able to share a quick anecdote of if there was an aha moment, I think we'd all love to hear about it. Let's start with you, Dr. Palmer.
Sure. The aha moment for me started in late 2016 when one of my patients with schizoaffective disorder who had tried everything. He'd tried clozapine. He was in and out of hospitals. He had tried numerous antipsychotics, mood stabilizers, antidepressants, stimulants, and everything else. And he was completely disabled and tormented by his illness. And that is the status quo for millions of people, for those of you who don't know. And so he was the status quo, just another patient. And he asked for my help to lose weight. And for a variety of reasons, we decided to try the ketogenic diet. Within a couple of weeks, he began to demonstrate a profound antidepressant effect. And within 2 months, he began to spontaneously report that his long-standing hallucinations were going away and that his long-standing paranoid delusions were going away. That man went on to lose 160 pounds and now today, almost 8 years later, has kept it off. It is sustainable. No GLP-1 for him. He actually did it, and he has schizoaffective disorder. So for the people who say these diets aren't sustainable, well, guess what? I can get patients with schizophrenia to do it. His story led me to treat now the hundreds of patients with a broad range of neuropsychiatric disorders, bipolar disorder, schizophrenia, schizoaffective, chronic depression, and others. And we now have numerous reports. We have over 50 reports in the peer-reviewed literature. This is no longer anecdotal. Please don't say this is anecdotal. Over 1,900 patients reported in the literature, over 20 controlled trials underway now. 8 of them are randomized controlled trials. This holds the potential to change the mental health field.
Absolutely.
You can tell I'm a little worked up.
Absolutely. I mean, this is, when you practice this way, you can't go back to the way you used to practice before. You just can't. And my aha moment wasn't a patient moment. I'll tell you about a patient in a moment. But my aha moment was in 2012 when I started learning about ketogenic diets for my own selfish reasons, because I was trying to solve some of my own health issues. that I've been trying to deal with, that everybody said if nothing's wrong, all these tests are normal. Conventional medicine wasn't able to help. So I just started instinctively experimenting with my diet and, was able to heal myself of all kinds of mysterious issues and became really curious about nutrition because the diet that I ended up with was almost upside down and backward from what we are told we are supposed to eat. And so if I had just gone out and then recommended this diet, which was a mostly animal foods, mostly meat, seafood, poultry, and some non-starchy vegetables, this was really it was a low plant ketogenic diet essentially. And lower in fiber, high in cholesterol, high in fat, high in animal protein, all the things you're not supposed to do. That was the diet that resolved all of the issues that I was having and more, including, I think a lot of people may be able to relate to this, mental health issues that I wasn't even aware were problematic. As you were saying before, Dr. Roberts, most of us are walking around with suboptimal health, and that includes suboptimal mental health. We just think of it as normal. We've come to expect so little of ourselves. We've come to expect our brains and bodies to deteriorate over time. That's not normal. And so when I had that experience, I didn't just start recommending this strange diet to my patients that would have been reckless and irresponsible. I started studying nutrition. For years, I studied nutrition and then started implementing these principles in my practice. And the first patient that I was able to convince to try something like this was somebody with anxiety, panic disorder, emotional eating, all kinds of things. In any case, sleep disruption, panic attacks. And she didn't want to take medication. And so I said, well, would you be willing to try a low carbohydrate plan? And 90% resolution of her symptoms within a week or two without any medication at all. And so that was the theory becoming manifest before my eyes. And just as Dr. Palmer was saying, these interventions or this way of thinking about nutrition and metabolism and mental health, it doesn't matter what the diagnosis is. Brain, body, depression, anxiety, Alzheimer's, because all cells follow the same rules and we need to give them what we think of as healthy diets is incorrect. So for example, we were talking about Alzheimer's before, the MIND diet, which is a modified version of the Mediterranean diet, failed in a 3-year randomized controlled trial to reduce the risk for cognitive decline. A 3-year randomized controlled trial. So, it's really important. We've got to get our nutrition rules right. And right now they are wrong. And that's going to go a long way. And then the ketogenic diet is in the next level. If you can get your glucose and insulin levels in the right range, that's step one. But many of us do now because we get such damage to our metabolism. We need to, for better or for worse, actually follow a ketogenic diet to be optimally healthy. And so, but the obstacles are, we're told that we must have carbohydrate. The brain needs carbohydrate. We're told, that plants are good for you and animals are bad for you. We're told you must eat whole grains. We're told that cholesterol is dangerous. All of these things are incorrect. And those are real barriers to, the lack of nutrition education is a real barrier to people embracing these very simple, very effective strategies.
Thank you both for sharing your aha moment stories. They're very powerful. I can relate to them entirely. And I also just want to wholeheartedly agree that while sustainability for some people it is a struggle, for other people they take to it like fish to water and realize they will never go back because of the wonderful things it's done. And we need to provide the support to those who are struggling. And that's where I think that Virta's model of care is extremely powerful, to have access to your health coach and your care provider essentially all the time. I am curious what you think has so far prevented the adoption of food as a mental health treatment. What do we need to overcome to realize the greatest benefit from this approach? Do you think it's a matter of time? Do you think there are specific barriers that we need to knock down?
I'll go ahead and start. To try to play devil's advocate and see things from the perspective of the skeptics. My strong guess is that, the mental health field for centuries, if not millennia, has been riddled with charlatans and snake oil salesmen, or legitimate quacks. I mean, we were doing lobotomies. People are doing all sorts of strange, demon possession, exorcism kind of rituals and other things. So mental illness has this long, steeped history in this mysterious, voodoo-ish kind of thing. And the reality is that there have been countless dietary interventions mentioned, that if people just take niacin, for example, that will cure schizophrenia. That was really popular in the 1970s. 80-90% cure rate with just taking a simple vitamin, niacin. Well, guess what? That's not true. It's not true. And so I think a lot of the skeptics feel like this is just another one of those. This is just another snake oil or quack person promoting something. I think the path to getting adoption is to turn to the science of cellular metabolism, and that means mitochondrial biology. And the reality is, it is a whole universe unto itself. There is so much that we do not know about mitochondrial biology. There is so much that we have to learn. But the other kind of science resource that we can tap is that of neurology. This is a 100-year-old evidence-based treatment for epilepsy. We have decades and decades of neuroscience research documenting how the ketogenic diet stops seizures. And it primarily does it through metabolic pathways, whether that's changes in the gut microbiome, changes in insulin signaling, reducing inflammation, changing neurotransmitters, and improving mitochondrial function, lots of things. But we can tap into that. And for those of you who don't know, what does that have to do with mental health? Those are seizures. Well, most of the pills that have been developed and most of the treatments, stimulation treatments and others that have been developed for epilepsy, we use them in millions of people with mental health conditions. So there are strong relationships between what we call mental illness and what we call epilepsy. And I think turning to that science is actually, even today, opening the eyes of leading world-renowned neuroscientists, psychiatrists, and others who are saying, OMG, I can't believe that this actually makes sense. The science lines up, but can you get people to do a diet and then they go to that? But yes, we can get people to do a diet. And so take this seriously and let's move on and develop more effective treatment strategies for our patients.
We are close to needing to wrap up, unfortunately, although it's been wonderful. Dr. Eid, I was hoping that you could give us the last words and to comment on what you see as the future and what are the broader organization and societal benefits we could expect if healthcare leaders more broadly support nutrition as a viable treatment.
Yeah, I mean, really, this is called the Moonshots Conference. I think we can expect the moon, and we should really expect nothing less. I mean, it's there's so much here that we can do, and healthcare cost savings, improve morale of workers, stop creating lifelong patients who are just accumulating lists of diseases and medications. healthy aging, we need to come to expect more. Nothing short of excellent mental and physical health for most of us. That should be our default, and everything else should be what we focus our healthcare dollars on. Are the diseases that are difficult to understand or more severe, or people with physical trauma, brain trauma, et cetera. That's where we really need to bring out the big guns in terms of our sophisticated technology and medications. But most of us, we're just not eating properly, right? I know it sounds simple, but that's what it is. And so it's really the only thing standing in our way is we have the wrong information. That's really the greatest tragedy of our time, but it's also the greatest hope of our time. Because if we have the right information, we can turn this around, I think, relatively quickly and make a huge difference. So it's really, I like to call metabolic psychiatry the science of hope, because that's why all of us do this work in this field, is because people with mental health conditions from major to minor, a lot of them don't understand how powerful an intervention these nutritional and metabolic changes can be. And we see improvements, sometimes even complete remissions from even very serious mental illnesses within weeks in many cases. And this is thought unheard of. But this is really, I do think that the leaders in technology, in healthcare, and in insurance, really, you've got such an opportunity here to become early adopters of the science of hope.
Thank you so much, Dr. Eid and Dr. Palmer, for sharing your time, perspective, and expertise and passion with us today. I know the audience and I are incredibly grateful.
Thank you so much for inviting us.
Yeah, thanks everyone.